All right, today we're going to be going over controlled articular rotations, or CARs, for the hip. The goal of this exercise is to move my hip through its entire range of motion as much as possible. This gives it constant feedback. So in cases where there's pain, it'll give it this natural feedback that's needed to keep the joint healthy and to hopefully diminish the pain and give you more range of motion. So the big two rules for these CARs are to, number one, only try to move the joint in question, in this case the hip, and only moving through pain-free range of motion. So in some cases you might have more range of motion, but if it starts to hurt, lower or make your bowl or your range a little smaller. So keeping out of pain. So for me, I'm gonna be only doing this on my right side. In general, if this is part of your CARs morning routine, you're gonna be going through the whole body. Or if you have a particular issue, you're gonna do and move that joint through its range of motions a couple times, usually 1 to 2 times on each side. So to start, I'm going to start in the standing position. This particular CARs movement can be done in a couple different positions depending on your flexibility or comfort. I'm going to start in standing. So for here, you might need a dowel, something to hold you on to, like a chair, so you're able to move through these ranges of motions without falling. So to start, I'm going to flex my right hip, just bringing it far enough to where it clears this left leg. Next, I'm going to externally rotate my hip so that my ankle is going to come towards the inside. So this going as far as I can go. Once I hit that, I'm going to hold that range and now go into flexion. So bringing my hip up as high as I can. Next, abduction, coming out to the side. Then internally rotating the ankle back towards the seat or the wall behind me. And then extension, so bringing my hip back and then going back to the floor. Then I would reverse that process. So extending back, coming out to the side, you can internally rotate here, then coming up as high as it can go, rotating the hip, externally rotating, and then back down. You would do that on each side. So for this one, a couple things that people might cheat. So bringing the hip up like that. So as I'm trying to rotate, I want more range, so I try to cheat that way. Or, especially with this extension part, you're not gonna go back as far as you think you would. So if I start to extend too much, now it's gonna start coming from my lower lumbars. So I only go back as far as you can without kind of introducing some lumbar movement. The next position that we could do this from is kind of this quadruped. In this position, you're not gonna be able to hit that external rotation. So I'm gonna do it for a couple different angles here. So here, I'm just gonna flex my hip up as far as I can go, come out to the side, rotate back, and then extend. And back down, reversing the process, internally rotating, abduction, flexion, back down. Side so you can get another angle. So flexing up, coming out to the side, rotating as far as I can go, extending back, and back down. Another position that we could do this from is laying supine, so on your back. So do it this way so you can see. So I'm going to bring my hip up, same kind of similar to what we were doing standing. So I'm going to bring it up just a little bit, rotating in. So externally rotating, flexing my hip up, coming out to the side. And since the floor is kind of in the way, just go as far as you can. I'm going to internally rotate the hip and then reversing the process from here. Flexing up, externally rotate, and back down. Do one more from this angle. So, coming up, rotating in, bringing the hip up, coming out, rotating back, reversing the process.